Hello, my name is Dr. Pielsticker, and I'm one of the Michigan Heart Cardiologists. I am also the Cath Lab Director, and I've been asked to talk about women's health issues today, particularly related to the field of cardiology. So, a lot of women don't know that the number one killer of women is heart disease. Women tend to think of it as a health problem, particularly related to men. However, it kills just as many women as it does men. And only 54% of women recognize that heart disease is the number one killer in women, more so than AIDS, car accidents, or even cancer. A lot of times I'm asked, who's at risk? And women who are at particular risk of heart disease include postmenopausal women, smokers, diabetics and pre-diabetics, patients who are obese, particularly if they're inactive, patients with a family history of premature cardiovascular disease. So if you have a first-degree male relative who's had a heart attack or a stroke or bypass surgery or angioplasty before the age of 55, or a first-degree female relative before the age of 65 having any of those problems, then you're also at risk. So patients who are also at risk include those with inflammatory disorders like rheumatoid arthritis or lupus, psoriasis. Those things put you at increased risk of cardiovascular disease as well. And then the other traditional cardiac risk factors are hypertension and dyslipidemia, or elevated cholesterol levels. Some of the warning signs of heart disease in women include chest discomfort. Women can have chest discomfort just like men. The most classic chest discomfort is a crushing chest pain that may radiate to your left arm or your right arm or up into your jaw. So those are classic symptoms, but also more atypical presentations are more common in women, such as epigastric discomfort, shortness of breath, anxiety, exercise intolerance. So those are symptoms that you ought to talk with your doctor about. Women do tend to wait longer than men to present, and some of that may be more atypical symptoms, some of it may be denial, some of it may be putting others before yourself, and really, if you're having some of the symptoms that I just discussed, you ought to be talking with your doctor about those things. A lot of times patients ask me what they can do to decrease their chance of getting heart disease, and what I tell them is that if you have diabetes or high cholesterol or hypertension, that you ought to be treating those things aggressively. Number 2, quitting smoking. Number 3, regular exercise. So the current recommendations include 5 days a week of moderate intensity exercise for at least a half an hour, or 25 minutes of high intensity exercise 3 times a week, plus a couple days a week of moderate stretching. Also, regular follow-ups with your primary care doctor and or your cardiologist if you have known heart disease. A flu shot is something that has been shown to decrease heart risk. Then also following either a low-fat, low-cholesterol diet, which has been the traditional teaching, but there's also evidence that following a Mediterranean diet with olive oil, nuts, whole grains also lowers people's heart risk of developing heart disease. And then if you're overweight or obese, losing weight to a healthy weight. You can visit allegiancehealth.org and take a health assessment online to give you an idea of your heart age. So that's allegiancehealth.org/heart age.